Yay Networks.
For example, a lot of people say they can't jump on the trampoline with their kids because they might leak a little, right? So
I can't sneeze without peeing sometimes.
Yeah.
Can you be allergic to semen? Like if your partner eats something that like you didn't know, is that even possible?
No. So it's,
Okay.
Short answer, no. A kegel. You don't want to squeeze your butt or your abdomen. You want to just be focusing on the pelvic floor. I think everyone's trying to do a kegel
I'm trying to do a kegel right now. Hi guys, welcome back to the Happily Ever Amber podcast. Thank you so much for joining in on the first episode last week, which I met with Dr. Amen, and we talked about ADD in women. On this week's episode, episode 2, I'm so excited to have Dr. Rena Malik. She is a fantastic doctor. She is a urologist and pelvic surgeon. I have this idea that we do not talk about really important things as women, as a society. We may shame some of these questions that we have about orgasms or what, overactive bladders mean. I mean, some of these things can be really embarrassing, and sometimes we let our ego get in the way of taking care of our sexual and physical health. So I'm super excited. You guys definitely do not want to miss this episode. It is so good. We talked about orgasms. We talked about the pelvic floor and what the heck the pelvic floor actually is. We talked about lubrication. We dove into a little bit about anal sex and whether it's good or bad for you. Okay, I'm not gonna give it all away. We talked about a lot of really good shit, and I cannot wait for you guys to see this episode, so don't miss out. I am so excited. I'm so happy. I have so many crazy questions. This might not be an episode for children, so for the viewers, just warning you. But thank you.
Thank you so much for having me. I'm so excited to be here.
So there's a couple of different areas that I want to touch on today, but I want to just give our viewers and myself, because you could always freshen up on your anatomy lessons. What is a pelvic floor? What's the purpose of it? Where is it in this region?
Yeah, so that's a great question. A lot of people actually don't know they have a pelvic floor. In fact, the other day I was talking to a male about a pelvic floor, and he's like, I have one of those. And so yes, both men and women have a pelvic floor. It's essentially a bowl of muscles and tendons and structures that sit in the bottom of your pelvis. And it holds up all your important organs. So your bladder, your rectum, in women, the uterus. So it has many functions. Of course, it is functions in posture, like helping you kind of stand up straight. It also helps with defecation or having a bowel movement. It helps with urination. It helps with pregnancy. It plays a role in sexual function. And so all of these things are, when you have a normal pelvic floor, you don't really think about it. But when you have a problem with your pelvic floor, it can be a multitude of things. It can be back pain. It can be difficulty having bowel movements. It can be difficulty with urination. It can be having more urination than usual. It can be pain with sex. For men, pain with erections, pain with ejaculation. So all sorts of different things that can occur, all because of dysfunction in these muscle structures or this whole entire structure of the pelvic floor.
Interesting. Okay, so in my mind, because I'm a visual person, it's like a hammock, right?
Sort of, but it's essentially like multiple muscles that are all together that make sort of like more like a bowl than a hammock.
Okay. As far as nutrition and exercise, how do those play a role in the functioning and the longevity of your pelvic floor?
So nutrition helps in terms of weight, right? So if you're having a good, healthy, nutritious diet, you're not going to put on extra weight. And when you have more weight, you're putting increased pressure on the pelvic floor. Now, does that mean that it's going to create problems or not create problems? It depends, right? Everyone has sort of a different genetic composition. So some people are more at risk for things like, for example, women can develop pelvic organ prolapse, which is essentially when the organs inside the abdomen start coming down and push pressure on the vagina. So you see the vaginal wall coming down like a bulge. And so that happens in some women who've had, one baby, and some women can have 10 babies and have no problem, or be overweight and have no problem. And so it can put you at higher risk for those things, but sometimes there's genetic components, like you have certain collagen structures or other things that make you more likely to have those issues.
And that's where you come in and you like do surgery and...
Yeah, so it depends. I mean, for that particular condition, you can do conservative management. You can do things like pelvic floor exercises, which we can talk about, but that can include Kegel exercises to help strengthen the pelvic floor. You can use different like devices like pessaries, which is like sort of like a diaphragm, but it's a little plastic dish. And they come in different shapes and sizes that you can put in the vagina to hold things up. So it doesn't always mean surgery, but yes, surgical options there's multiple different surgical options that you can use for prolapse, like vaginal or abdominal, to help kind of recreate the pelvic floor, or to use mesh products if you so desire to help kind of support that. In terms of exercise is it's great, right? Exercise is good as long as you're doing it correctly. So if you are doing good breathing exercises when you do any sort of heavy lifting, so what that means is like exhaling on the exertion, that helps you. When you exhale, you're actually supporting your pelvic floor. So when you're doing the exercise, your pelvic floor is contracting to keep things in good position. When you inhale, you're relaxing your pelvic floor, and you want to do that when you're not doing the exertion.
You're exhaling out of your mouth, though,
yes.
right?
Yeah.
Okay.
Yeah. Well, I mean, I think you can exhale out of your nose too. It's a matter of like but it's easier to exhale. You get a better exhale out of your mouth.
Got it.
Yeah, so that's sort of how exercise plays a role into it, but certainly having strong muscles around your pelvic floor, like your gluteus muscles, your abdominal muscles, your lower extremities, those things are helpful as well.
Well, you mentioned Kegels, and this is like a big topic of discussion, I feel like, throughout my entire life, because after I had babies, I had 2 vaginal births, and I always felt like I had a hard time holding my pee, or I felt like I had the urge to always, have like an overactive bladder. And my doctor's like, oh, do Kegels. And I'm like, but they don't really explain to you in a way of like why they're so important. We just know that you're supposed to like, go tight. And I'm like, but that doesn't work for me. So can you kind of dive into like what the heck a Kegel is? How do we practice? And how do you actually know if you're doing it properly?
Yes, this is great. I'm so glad you brought this up, because people come tell me all the time, I'm doing Kegels. I'm like, are you really? And so one, do you need to do them? So is that the right thing for you? If you're having overactive bladder symptoms, doing Kegels in the traditional way you think about doing them, it may or may not help. It actually may make it worse. And so it actually depends on the problem that you have. So if you have a weak pelvic floor, so if you have signs of a weak pelvic floor, which is usually diagnosed by a physical examination, but sometimes can be associated with like bladder incontinence or, like prolapse, like we talked about. Those situations, Kegels can be helpful. And sometimes people do them recreationally to sort of like help with, they want to like have better sex or have better orgasms.
Does it tighten your vagina, like the inside of your vagina as well? Or
so the vagina is just basically like skin, right? So it's actually the muscles that are that are in the pelvic floor that you're tightening. And so those muscles, you don't want to tighten them. You want them to have normal function. You want them to squeeze when they need to squeeze and relax when they need to relax, because otherwise you can create problems, which is why I say doing Kegels is not always correct for everybody, because some people will do so many Kegels that their muscles will get so tense and they won't relax. And it's hard for us to tell, because we don't really like think about our pelvic floor all the time, right?
No.
We don't really like, oh, what does it feel like when my pelvic floor is tight? You don't know. And so a lot of times I'll see patients who have really high tone in their pelvic floors, and that'll be because they are often type A personalities. They are often very stressed out. They're having major stress in their life. They've had trauma in that area. And they're coming to me with symptoms of overactive bladder, or they're coming to me with symptoms of recurrent urinary tract infections, or they're coming to me with symptoms of like just discomfort in this area. So that aside, what a Kegel is essentially you're you're squeezing the pelvic floor muscles, and then you're relaxing. And so the way I describe it is you want to sort of pull your vagina up and in.
Okay.
Or you can practice like when you're peeing, you can stop the stream, and that's a Kegel. And you don't want to squeeze. Yeah, you don't want to do it when you're peeing, but that's how you can kind of know that you're doing it correctly.
I'm going to hide from my kids. Mom's in the bathroom practicing Kegels. Sorry.
It's a good idea.
Okay, so when you're peeing, sorry.
Yeah. So then when you do it, so you figure out how to do it. And I tell people and you don't want to squeeze your butt or your abdomen. You don't want to squeeze. You want to just be focusing on the pelvic floor. I think everyone's trying to do a Kegel
I'm trying to do a Kegel right now.
So when you're...
I'm Kegeling.
So you want to start by doing them just like any other muscle. It's going to be weak if you've not been doing Kegels, right? So you start lying down and you just want to focus on those muscles, nothing else. You're not sitting up. You're not trying to do something else. You're just doing that. And so you squeeze for 5 seconds, relax for 5 seconds, and you do like 10 of them.
And do you feel your vagina move?
You sort of feel the tightening and then you feel the relaxing, right? You should feel that sensation. And if you're not, there's like a whole bunch of tools that you can use. You can very
Shock
simply
treatment.
For women, you can put a finger in the vagina and you can feel the muscles contract on it. You can also buy there's different devices online you can buy that have sensors on them that will tell you that it's squeezing and relaxing. And for guys, they actually have one where you can sit on it and it'll tell you if it's squeezing or contracting. It's called Kegel. I did a video about that before. But there's different things you can buy. But the best thing is to go to a pelvic floor physical therapist because they'll really work with you on doing Kegel exercises and other pelvic floor exercises because Kegels are not the be-all, end-all. We talk a lot about them. They've gotten a lot of popularity. But there's a lot more to your pelvic floor than just Kegel exercises. And so it's like going to the gym with a trainer. They're really going to work with you to make sure you're doing the right thing.
Got it. Okay. So now I want to shift and talk about orgasms and arousal. And first, I guess my first question is, what are the psychological changes when you're having an arousal? Like where in your body does that live? Because you kind of, you feel it, but it's also maybe some people feel it in other places, right?
Yes. So it's important here to differentiate arousal from desire, right? Arousal is your body's physiologic response to something that is arousing. So a lot of times I think people get confused because we think desire has to come first and then arousal, right? But sometimes you'll be aroused, but you might not be ready. You might not be into it right away. And then desire comes afterwards. And that often happens when you're in like long-term relationships, right? You're like, I don't see you and want to jump you, but like we might be close to each other and we might be touching each other and be like, oh yeah, I remember this. This is fun. Oh, I do want that,
Yeah.
But so you're aroused first and then desire comes. And that's completely normal.
And is that like a hormonal thing? Like if sometimes you're, I don't know, you're furniture shopping or you're like making dinner and all of a sudden you're like, oh my God, I like totally want to rip your clothes off right now. You don't want to do it in public, but.
So when you have arousal, what happens, it's sort of like a cycle, right? You see something, you hear something, you feel something that triggers your desire. And sometimes before that happens, your body starts preparing itself for the possibility of sex, right? So your body's starting to, for women, make lubrication. You're starting to maybe have nipple erection, those sorts of things. And then you're sort of the desire, again, it used to be thought the desire always comes first, but now we know that it can sort of come anywhere along that spectrum. And so the biggest and most powerful organ in your body for sex is your brain, right? You cannot have desire if your brain's not in the right place. So if you are not like completely there and mindful with your partner, you're not going to be into it. And it's going to be more difficult to reach orgasm. It's going to be more difficult to enjoy the experience. And that's, I think, a huge issue that we're seeing more and more of.
Is people just not.
Yeah, I mean, it's stressful, right? Life is stressful. People are busy, especially as they get kids or they're so in the beginning of a relationship, it's just you and your partner and, and then you're new, you're excited. And then things become sort of, you get routine or you get kids or whatever it is. And then it becomes sort of, monotonous. And so adding diversity to the experience. So trying different things. Don't always have sex in the same place. Don't always do it the same way, right? Try to do different things. And then also like actually scheduling time for intimacy. So like saying like, we made time for this podcast. We scheduled in our calendars. Like same thing, make time to say this is going to be our time for intimacy. And sometimes it's said and sometimes it's not, right? Like, your partner always wants to have sex around this time. So you sort of like get it in your head that you're going to have sex around that time, and you get yourself mentally ready to like be dedicated to that act, right?
Yeah, and you got to ask your partner like what do they want, right? Like what for some women, it's like during the day they want to have sex. They might be too tired when they go to bed, or for men it's a certain time of day, or like I guess communication is so important in a relationship, which I'm sure you have seen.
Absolutely. I mean, I think we don't talk about sex enough. I say that like all the time because we obviously show sex in so many different ways in public media, but we don't get taught how to have these conversations with our partners or with the people we're having sex with, right? To ask for the things that we want or to discuss the things that we want. And there's so much shame and discomfort and like miscommunication that happens because we don't do it. And I think if you just had the conversations and knew that it was going to be a difficult conversation to have and it's going to take some time, like relationships would be a lot better.
Yeah, and I think that having families and work, like we don't really sit down and think, gosh, what do I want? What do I want my partner to do? It's just like we're thinking about food and schedules and practice and grocery shopping and what's due for work and timelines and all that stuff. So I feel like having a moment of sitting down and really like asking yourself, because sometimes it's like, what do you want? I don't know. Stick your penis in me and see what happens. Like, I don't know. Let's see if I'm ready. I don't know. And I think it's really hard for women now because we live in such a world where it's just go, go, go. And there's so much stress, like you said, and so much chaos going on in the world that we don't give ourselves the permission to ask those really important questions because it's so essential to longevity, our, physical health, which I would love to hear more about. It's like having a healthy sexual life, right? Whether that's one time a week, one time a month, whatever it is for you and your partner. How does that play into our health as humans?
Yeah. Well, to go back one step, you mentioned how we don't know what we want. And so that's a huge part, right? If you don't know what you want, you need to spend some more solo time figuring that out, right? What turns you on? What do you like? And I think that's so important, right? Because if you don't know what you like, how can you communicate that with your partner, right? Yeah. And then in terms of sex, there is no prescription I can say that you should have sex this amount of times, right? And I think people get really fixated on those types of questions. How often should we be having it? My partner wants it this much, I want it this much. What's the right answer? And the right answer is what's right for your relationship or whoever that is, whether it's one partner, multiple partners, like just figuring out what is good for both of you. And then deciding, the benefits of sex are so many, right? Because having an orgasm has actually medical benefits, right? It's known to improve sleep. It's known to improve focus. It's known to allow you to have better mood and less anxiety, less depression. So there's so much value in using our bodies to experience pleasure. And so there is value in it, but that means that sex should be pleasurable for both parties or however many parties are involved. So, everyone needs and deserves pleasure. And so knowing what that is for you and communicating that with your partner.
So talking about orgasms, what is the difference between a vaginal orgasm and a clitoral? Clitoral? Is that the right term?
Sure.
Okay. Orgasm.
So I love this question because they're all orgasms, right? There's no they're all from sort of stimulation of very erogenous zones that have tons of nerve endings. But what we do know is that the clitoris is the most reliable route to orgasm. The clitoris is like the male penis. Exactly in embryology, when you look at like the embryology, they look the same. The clitoris and the penis, as you go on, when they become the man, that becomes the penis, and the clitoris stays there. And the clitoris actually extends deep into the pelvis and then makes like a wishbone shape. So when you're actually stimulating the vagina, you're also stimulating those legs of the clitoris. And so very often you're still getting orgasm from the clitoral stimulation, even if it's vaginal. Now, some people do get orgasms from cervical penetration. So if you are getting really deep and touching the cervix, some people find that very pleasurable. Other people find that uncomfortable. So not everyone's the same.
Like going so far back where you're actually like poking at the IUD, you're like, oh my God, you just touched my IUD. Thank you very much. That hurt. Is that possible? Like, is that what you're feeling essentially, or no, it's not?
The IUD is in the uterus. So it's the strings of the IUD. Yes.
Okay.
Yeah.
Okay.
But
so if pain's happening there.
Yeah. So some people, so back to arousal, when you're getting aroused, your cervix actually moves up and out of the way. The vagina lengthens and widens to then prepare. Our bodies are amazing, right?
Oh my gosh. So this is insane.
It actually prepares for sex, right? And so if you're not aroused enough, and your cervix isn't moved out of the way enough, it could be painful, right? Because then you're having it can be uncomfortable for some people.
And that can cause potentially like bleeding if you don't give your, the vaginal walls enough time to expand.
Yeah, especially if you're having like issues with decreased estrogen in the area because the tissues are thinner or more friable, particularly in women who've had menopause, either surgically or through natural menopause. Mm-hmm. We're seeing a lot of that because they're not making as much lubrication. That's sort of a normal sequelae of menopause. And so the other thing is adding lubricant is really important. I think everyone should be using lube. I think it makes sex more fun.
Like oils in the kitchen lube, or like whatever's on hand. Like what my question is, like, what's a healthy lube? Like coconut oil, for instance, right? Like I have a massive jar of coconut. All of us are in there putting it all over our hair, our skin. Like I don't want to be double dipping. Like, so what's a good lube that you would recommend that's safe also for the health of our vaginas?
Yes. So there are water-based lubricants, and those, you have to be a little bit thoughtful. Some of them have a lot of preservatives in them or other ingredients. So you want to get the ones that are the most sort of simple water-based. If you're going to get those tend to dry out quickly. So they're great because they aren't as messy, right? They do dry out. But then if you're having like a very long sexual encounter, you'll need to reapply. And I usually recommend getting one that's pH similar to the vagina because they actually do come in different pHs, and some of them, based on what's in them, have higher pHs than they should. So you want to make sure you get ones that are sort of similar to the pH of your vagina so that otherwise you're not getting at risk for like yeast infections or things.
So how do you know the pH of your vagina?
So if you look on the bottle, it'll tell you, this is like similar to vaginal pH.
Oh, got it.
Yeah,
You're not having to like swab yourself and like do like science experiments at home. Like, what's the kids? We're going to find out mom's pH.
No, so the vaginal pH is low. It's like below 4.
Okay.
2 to 3 is actually the pH. And so if you come to, my office or other people who specialize in sexual health and you're having issues, sometimes we'll actually swab the vagina to see the pH to just assess if, that may be a sign that there's a hormonal abnormality that's causing the pH to be off. So water-based are those. Then silicone are another category. Silicone-based are more slippery. They do tend to sort of last a lot longer. So I think those and oil-based lubricants last much longer. And so that's good for, penetrative intercourse. And those, you can basically use and then you usually don't have to reapply. So that's kind of nice. And then oil-based, there's plenty like coconut oil and olive oil-based. Coconut oil I see more often because it's also if you use coconut oil from the kitchen, it's a little easier because it's not as runny, right?
Yeah.
So yeah, oil-based is fine, but if you're using a condom, don't use oil-based because you'll break the condom. If you're using silicone-based lubricant, don't use it with your toys because it can degrade the silicone on your toys, on your silicone-based toys.
Got it. Okay. Yeah. Wow. I have 2 questions regarding this. When you talk about lubrication, this is my ADD, which my previous episode with Dr. Amon talked about sex with women with ADD. But when it comes to anal sex, is it not healthy if you go from the anal to the vagina?
No, you should not. You should always clean off if
Okay.
you're going to do that. And use a special lubricant for anal sex.
Okay.
So if you're going to use a water-based, so the anal pH is around 6. So you want to use the lubricants that are pH that are similar to anal tissue. And you always need a lubricant. You never can have anal sex without a lubricant. The rectum is not self-lubricating. Mm-hmm. So you can create true injury and bleeding and all sorts of problems if you don't use a lubricant.
Got it. Okay. Can you be allergic to semen? Like if your partner eats something that like you didn't know, what could happen is is that even possible?
No. So it's
Okay.
short answer, no. So, the semen is made up of a multitude of things, but it's nothing to do with it's not, you can change the flavor a little bit, I guess, with certain foods, but overall it's not really changing like the actual components of it, right? So it's like fructose and vitamins and other things and kind of, things like that, elements that are in semen that are just sort of made by the anatomical structures.
So you can't drink pineapple juice and have like better semen.
So, there's no studies on this, right? But there's like if you drink enough consistently over time, you can change the, slightly sweeter. Is it going to be like it tastes like candy? No, right? It's like slightly sweeter. And if you like smoke, and
we would have a big problem if that was the case. There'd be a lot of people spending a lot of time in the bedroom.
Yeah. But if you like smoke or you drink a lot of coffee, you may notice that, or eat a lot of meat, you may notice the semen tastes a little bit more musky. So like it really does depend a little bit on diet. But again, there's no studies. Like I can't tell you scientifically this has been studied because no one's tasting semen in a research study.
There's always a first.
Yeah.
Okay, my next question is more like a debunk, like a myth. Is it true if you drink coffee before you have sex, it gets you to the orgasm quicker or makes your orgasm more intense?
Well, coffee can affect the dilation or constriction of the blood vessels. And so in theory, it could potentially make, allow for increased blood flow to that area a little bit quicker. But again, I don't believe this has been studied. I think this is more of like a TikTok phenomenon that's sort of taken over.
Oh, got it.
Yeah.
Okay. Well, I want to just kind of switch gears and talk about incontinence, overactive bladder, because this I feel like I talk about it so much. I don't want to say so much, but like enough with my girlfriends. And we have so many questions on the differences and like the different types.
Well, the way I describe it is so when you think about incontinence, the two most common types are stress incontinence. So that is incontinence that occurs with stress, which is like coughing, sneezing, exercising, walking, sitting to standing, those sorts of things. So you always notice that when you, for example, a lot of people say they can't jump on the trampoline with their kids because they might leak a little, right? So
I can't sneeze without peeing sometimes.
Yes.
And if you see me cross my legs, you know why. Or I can't laugh. I mean, it's a real problem.
And so the cause of that is a weak pelvic floor. And so that is often the cause. It can also be a sphincter weakness or an intrinsic sphincter weakness. That's more common in people who've had surgery or they may have a neurologic condition. But regardless, that's one type of incontinence, and that's treated differently than urgency urinary incontinence, which is the leakage that occurs when you have the sudden desire to go to the bathroom and you can't delay. So you're trying to rush to the bathroom, gotta go, and you have an accident, right? So that is that. And sometimes, as people, sometimes actually the most common type of incontinence is mixed. So you have both types of incontinence. Now, the reason you have urgency incontinence is usually because the bladder is squeezing before it's ready to. So before it's completely full, your bladder contracts and you have this urge to urinate, and then sometimes you don't hold it. Now, why does this happen? It's usually because there's an issue with the bladder. Sometimes it could be because of a neurologic condition. Sometimes it can be because you're drinking a lot of fluids or you're having a lot of bladder irritants. So coffee, tea, any caffeine, alcohol. For some people, spicy foods, acidic foods, artificial sweeteners, or tomato-based products. I joke with my patients that's like, everything delicious in the world basically can irritate your bladder. But you don't have to stop all of those. I tell people just to try to stop one and see if it's better. And if it's not, then, move on to other things. But other things that can cause is drinking a ton of fluid. So we're like a very overhydrated society. Everyone's like, drink a gallon of water a day, but you're going to have, urgency and frequency.
Is the slower you drink the water, like taking sips instead of chugging, does that help your body absorb so it's not rushing?
Exactly.
Right.
Yeah. So taking sips, I tell people drink whatever you want during breakfast, lunch, and dinner, and then sip on water in like a, regular water bottle throughout the day. But don't drink like these, don't force yourself. Your body is so smart. It tells you when you're thirsty and when you need to drink. So you don't need to drink a gallon a day. If you're drinking it and you're feeling fine, you're doing great, that's fine. But I don't think you need to. And if it's causing you distress because you're going to the bathroom all the time, then you need to kind of pull it back, right?
Right.
And then other things like constipation can make it worse. Smoking can make it worse. If you're overweight, that can make it worse. So, and then those are sort of all different causes that can cause that. And that is treated a different way than stress incontinence. And overactive bladder falls into that same category because some people, including men, won't have the leakage, but they'll have the urgency. They'll go often during the day, like 8 or more times during the day, or they'll wake up at night to go a lot. And that whole constellation of symptoms is called overactive bladder.
Yeah, that's the worst. When you wake up, sometimes I wake up and I'm like, this is the third time I've gone to the bathroom.
Yeah.
And then you're like a mess the next day and you're just like, what's the point?
It's a real problem, and particularly in our elderly patients because they can fall in the middle of the night, and falls are really, really bad in the elderly patients. When they get to the hospital or they break a hip, that could be the straw that broke the camel's back. That could change the trajectory of the rest of their life. And so I tell my patients and anyone who has parents who wake up in the middle of the night, you put some lighting or like automatic lighting so that when they stand up, it immediately lights up, and then make sure their phone is near them. So if they fall, they can call you immediately, but just like really make it easy for them to get to the bathroom, because after about 50 to 60, you're going to wake up once a night. Your body just makes more urine at night than it did the first half of your life. And so you're going to wake up once at least.
But aren't there like pills or herbs or something that you could take? Because my God, okay, I'm 35. I imagine if I'm waking up sometimes 3-4 times in the middle of the night to go, I'm never going to sleep.
Yeah. No, so there's definitely medications to try. There's, we tell people to avoid drinking too much before bedtime and avoid those bladder irritants. But of course, people still will wake up a lot. But I think the key is to get evaluated to make sure there's nothing else going on that could be contributing to you waking up at night. So some people have, pelvic floor issues. Some people have undiagnosed sleep apnea. So making sure that there's nothing else, or kidney problems, right? Making sure that there's nothing else before you start doing like all these other things, to make sure you're not just taking pills for the sake of taking pills, right?
Right.
Yeah.
So for women in general, if you're like, about to start your period, do you see changes in the amount of times that you do use the bathroom? Does that affect like bedwetting or just, having to constantly go all the time?
Not typically, but I will say I've seen some patients where it is very hormonally driven and they go more often around their period, but that's not always the case. So I would say it's less common. It's pretty uncommon.
So do we all have, I feel like this is a silly question, but if I'm thinking it, maybe someone else is, do we all have different sizes of bladders and the amount of liquid that it will actually hold?
Absolutely. So the average is somewhere between 16 and 20 ounces, or 10 to 20 ounces really, but 16 ounces is probably the average. But some people, they're like, my whole life I've had a small bladder, right? And some of it is I will say that some of it we don't know when it started, right? Like a lot of kids hold their pee a lot during school, right? So they don't want to use the bathroom. It's disgusting, whatever it is. And then that kicks off a whole like lifetime of dysfunctional voiding, or certain occupations like I can't leave, like I'm a surgeon, right? So I'm operating, I'm like, I can't go to the bathroom. I'm going to stay till the surgery is done and then I'll go after, right? Teachers, nurses, hairdressers, like these people never go to the bathroom because they literally can't leave what they're doing. And so it can create real problems over time. And our brains are really sensitive. So one, if you're holding your pee for long periods of time, your muscles over time can get weaker. Those muscles that squeeze the bladder over time can get weaker.
Oh, it's so funny because you would think it's the opposite. If you're holding it, like you're tightening the muscles, but
yeah, so the actual bladder muscle can get weaker. So then it can become more difficult to empty. So then when you go, you're not completely emptying. And so then you're like, oh, I got to go again pretty quickly because I'm not emptying completely. Other times it can be like you're always like a just in case peer. So you've always been like, I got to pee before I go. And then you you train your brain that, oh, that's the size of my bladder. And so I have to pee at that size, like, because I'm always peeing just in case. So every couple hours I'm peeing, oh, that's how big your bladder must be.
It really can disrupt your life. I mean, I remember as a kid, like my mom would be like, everyone go to the bathroom. And I that's what I started doing with my kids. But when you're constantly going to the bathroom, it really, I mean, we live in LA, like California, the traffic is horrible. Like you can't go more than 15 minutes. You're like, oh my God, I have to go to the bathroom again. I have to go to the bathroom again. Like, where's the cup in the back of the car when you're stuck on the 405 freeway? But yeah, it's a real problem. But thank you so much for explaining all of that. Cause I feel like these are things that, you know, whether we're talking about orgasms or incontinence or sexual health, like we don't really talk about it enough. And if we go and look at it, there's a lot of misinformation out there. And that's the most important thing is like, I guess for all the viewers and listeners, it's if you have questions, don't be afraid to ask your physician, write them down. I think that's like a big thing with me is like, if I think of all these questions, you know, and I know I have an appointment coming in the next 3 weeks or 6 weeks, I'll write it down because these are questions that will help your life and ultimately lead to your happily ever after, not having to deal with some of these issues.
And I think that, I really want to thank you for putting this on your podcast and making this platform to talk about things like this, because we need more people to know the accurate like information and kind of drown out the misinformation. So one, I really appreciate that. And thank you so much.
Thank you.
And two, I would say, you know, don't wait. I think especially for women, we delay so long. We're so busy taking care of our kids, of our partners, of our parents, right? And you get to that point where your parents are getting sick. So then you start taking care of them. But we still have to take care of ourselves so we can be our best selves to do everything else, right? And I will see so many women who are like, I've been leaking for 40 years. I've been dealing with this for 40 years. And I'm like, wow. And like, I just didn't have time to take care of this. And I get it. I totally understand. It's not going to kill you. It's not life-threatening. And I see it with men too, like especially with sexual dysfunction, they're embarrassed to come see the doctor. They're worried. And so they'll try all these things like gas station pills that don't work and whatever.
God forbid.
And they don't come, they don't come and they're so embarrassed and they're having issues in their relationship and they're, there's so many downstream consequences of delaying your care that you don't even realize, right? You're like, oh, I'm so stressed about peeing all the time that I can't focus at work. Or I'm so stressed about like my relationship is horrible because guess what? I don't feel really sexy when I'm going to the bathroom all the time or like whatever it is. And these things have huge impacts, but like we just don't think about it. Like, oh, it's just, I shouldn't worry about this. At least I don't have cancer or at least whatever, which is true. Thank God you don't. But like you're worth taking care of and you're worth taking the time to do that.
I love that. I love that so much. Okay. So for anyone who wants to find Dr. Malik, where can they find you?
I am at Rena Malik MD on all the platforms, Instagram, TikTok, Facebook. My biggest platform is YouTube, where you can find my channel, Rena Malik MD. I'm also starting a podcast, which you can find on YouTube, Apple, Spotify, which is also the Rena Malik MD podcast. And I'd love to have you guys all there.
Oh, I can't wait. And let me tell you, if you guys have not seen her content on YouTube, you have to. She has the best content. I mean, I literally could listen to hours and hours and hours of like you're just such a boss bitch and I love it.
Thank you. That's so kind. Oh, and if you want to see me as a patient, I have a clinic in Newport Beach, California, where I take telemedicine patients in multiple states. You can look on my website, California, Florida, Illinois, Maryland, New York, New Jersey, Virginia, Texas.
Okay, well, you definitely have a new patient in me. And maybe we should do like a YouTube video of me coming into the office. We're not going to show anything, so guys, don't get too excited. But we could do like what it's like to come to the office, because we're so used to going to other physicians like an ENT or your family doctor. Yeah, I don't think a lot of people will say like, oh, I'm going to go to the urologist today.
Yeah, and no, that'd be great.
Like you're so important into our everyday life. So
Thank you so much.
Thank you, everyone, for joining us on this second episode of the Happily Ever Amber podcast. Please don't forget to subscribe, like, and follow us on Instagram, YouTube, and wherever you get your podcasts. And thank you so much to Dr. Rena Malik for coming on and talking all things vaginal health. And I can't wait for you guys to hear what our next guest is. And if you guys have any questions, if you guys have any thoughts about future guests, please let me know. We are a family and I can't wait to have you a part of this journey.
Yay Networks.